So just to give you a quick overview then, some of the drivers and some of the systems that are really helping us to shape how we take school nursing forward. We launched the vision over 12 months ago now, and it was very well received out there in the field. Clearly we've got new structures, we've got new roles for the Department of Health, for the Commissioning Board, and also we've got the responsibility for public health lying very much with local authorities. But all of that comes back together through the Health and Wellbeing Board. We still have those same policies to actually help us to embed. So the Healthy Child Programme is still very much alive and is still our framework for delivery. And we need to actually be using that much more effectively with local authorities and particularly with schools. Now, throughout the last year, we've been working with schools, and schools really don't understand what the Healthy Child Programme is. Many of them still think that they're working towards the Every Child Matters agenda. And while some of those key threads that run through Every Child Matters still resonate, we need to be really making sure that our schools and head teachers, governors understand what the Healthy Child Programme is. So we need to really start thinking about how we do that as a profession. Our plan to actually make sure that we deliver all of this is clearly through the School Nurse Development Plan, which will continue for a further year at least. So we know that as we move into the new financial year, that we have a commitment from the Department of Health to continue with the programme and to continue to raise the profile for school nursing. Our key messages haven't changed in that we want to think about that early intervention, prevention, and how we actually make sure that the service is fit for those young people locally. And I think over the next year, it's going to be very much about testing out. How do we work together more effectively? How do we maximise contributions and make sure that we really do understand what everybody can offer? And I think through the school nurse vision and model, we're really clear about what school nurses should actually be doing. We're not actually the catch-all for everything, the mop-up service. This is very much about being clear that the primary source for school nursing is about public health delivery. Localism is really important, and I think the whole issue around local authorities now actually commissioning public health is really, really crucial. And there's an opportunity now over the next 12 months while we're in that phase of new relationships to really push what the school nurse unique contribution actually is to delivering public health. School nurses need to reaffirm their position as leaders in public health and make sure that people really understand what it is that you actually deliver. I won't dwell on this too much, but it's the vision. We know that we've got the vision, it's out there. I guess my challenge to you is now that you need to be able to articulate this to local authorities, to your commissioners, and make sure that they understand what it is that you should be delivering locally. This is what your core offer is, and then there needs to be some local variation depending on your population needs. But this should be the basis for your commissioning specification. And many areas now are reviewing their school nurse service offer and commissioning spec to actually fit in line with this. And we've also got universities that are looking at their curriculum to make sure that it does actually reflect this. Leadership is important, and I think because we're seeing so many changes, and I think because the world is changing quite rapidly, how we deliver services is very different to how we delivered them 5 years ago. We need to actually work smarter, and we need to make sure that we can deliver services in a different way that are responsive to how young people want them. Young people told us they wanted access to early help to avoid crisis. They wanted it at times when they needed it most, and they wanted to only have to tell their story once. So they didn't want to have to tell their teacher, tell you guys, and then have to go and tell CAMS or their GP or whoever else it might be. So we need to think about how can we actually work in a much smarter way. This just gives you an overview of some of the products that we've been working on and some that we are actually going to be working on over the next year. So we've developed a whole raft of pathways, and I know the Safna stand outside has actually got some of those pathways. So we've got a whole raft of pathways to help you to start having those conversations with commissioners and your partners to make it clear what it is that you're going to be delivering and what your role will be. So we've worked with Youth Justice. We're currently working on the complex needs pathway with teachers and teaching assistants. We're working on young carers piece of work, and I'll come back to that. Safeguarding pathway has been published. We're working on an emotional health and wellbeing pathway and a sexual health pathway. And they're all important components of your role that I think sometimes commissioners might not know that you actually input in relation to that, and there might be funding to actually support the school nurse role.